Keeping your mouth clean is so important. We've all once had the temporary teeth, and when they have been replaced to the permanent, you're gonna have to live with them for a lifetime. Even a little carelessness tends to cause tooth decay, and in some cases, you can lose your tooth due to inflammation of the gums. Especially, if you had a dental implant surgery, you should manage them more thoroughly. Today, I'm going to tell you how to clean the mouth for those who have dental implants. Peri-implantitis literally means inflammation of the gums around the implant. Since implants are artificial teeth, they do not cause cavities, but they don't have the periodontal ligaments which the natural teeth have, so they are more vulnerable to shock or inflammation. Inflammation sometimes occurs around the implant and develops more severely because the pain is not felt. When gum inflammation becomes severe and the bone loss occurs, the strength to support the implant decreases and the inserted implant may lose its stability. Peri-implantitis is the most common side effect of implants. Since it is a side effect that can be prevented, it is necessary to manage it carefully. You should brush your teeth as much as possible after breakfast, lunch, and dinner, as well as when eating snacks. It's important to brush your teeth up and down, feeling like you're removing debris between your teeth without applying too much force. If you brush from side to side with excessive force like a Hulk, it will irritate the gums more than necessary, and the roots of the teeth can be easily exposed or worn out and cause toothache. With just brushing, it may be difficult to thoroughly brush the space between teeth. In this case, it is better to use dental floss or an interdental brush. When using floss, it is important to cut an appropriate amount of floss, roll it up with both hands, insert the floss between the teeth, and remove it with the feeling of repelling food. Also, when using an interdental brush, choose an appropriate size according to the size between your teeth and wipe the teeth back and forth. Those who don't drink water often and those who smoke have a faster rate of accumulation of dental calculus than those who do not. On average, you can visit the dentist to get teeth scaling once a year, but if you're the person who tends to see the more calculus, it is desirable to get scaling about once every 6 months. When you smoke, the temperature in your mouth rises and your mouth becomes dry. If your mouth is dry, food debris in your mouth is more prone to sticking, and it can be an environment in which germs can grow. This can cause frequent inflammation of the gums. Therefore, it is important to quit smoking, and if there are people whose mouth dries easily due to severe stress, it is important to prevent dry mouth by reducing coffee or caffeine drinks. Today, we learned how to care for an oral health if you have an implant. If you want to use the implants longer and stronger, try these methods today.